Hi, I'm Kathy B, and I'm here with Dr. Matthew Rowe. He's an upper cervical chiropractor, which is very different than your typical chiropractor. In fact, his patients like to call him the healing doc. Upper cervical chiropractic care does so much to help heal different parts of the body that you may not even realize you're having trouble with. So Dr. Rowe, tell us a little bit more about what you do and how your practice is different than the typical chiropractic practice.
Yeah, thanks, Kathy. One of the biggest misconceptions in healthcare today is that the body can't take care of itself, that we have to give it something in order to get it to that healing process. And this couldn't be farther from the truth. The body is a self-healing organism. Healing comes from within. And given the proper conditions, the body can actually get over just about anything. Headaches, migraines, fibromyalgia, chronic fatigue, ADHD, allergies, ear infections in kids, all of these things are things that we see in our office every day with tremendous results. And it's because we give the body a chance to begin the healing process.
How do you do that? I hear that all the time, that if you give the body the opportunity to heal itself, it will. So how does your practice, how does your technique facilitate that?
Well, what we do is we focus on an area of the neck called the upper cervical spine, where there's a small piece of the brain called the brainstem. And we perform very, very gentle but specific corrections to this area, and it's those corrections that restore balance, which restore health, and eventually can restore life.
Okay, so I heard you say the buzzword fibromyalgia, because it seems like everybody out there has been diagnosed with fibromyalgia or is suspicious they may have fibromyalgia. So just for the purpose of understanding how what you do might benefit somebody that's going through having those symptoms, how does it help with those symptoms?
Well, the science behind what we do is really the brainstem. Healing comes from above in the brain, down through the brainstem, through the spinal cord, out to the whole entire body. The nervous system controls and coordinates everything in our body. What fibromyalgia is it's an overactive nervous system. For example, we'll talk about fibromyalgia. If the body isn't balanced, if this nervous system isn't able to function properly, then our body begins to break down. So as an upper cervical doctor, what we do is we focus for these imbalances in the upper neck, correct them, so that way healing can begin.
And I know in your practice you also recommend to your patients that they not only come in for your care, but also to watch their diet and their lifestyle and so forth. So would you say that yours is a piece to the puzzle, or how does what you do fit into the whole scheme of being well?
That's a good question. Yeah, absolutely. Proper diet, nutrition, exercise are extremely important. Making sure that you have a properly functioning nervous system is probably at the top, because we can eat the right things and we can exercise, but if our body doesn't know what to do with these nutrients, if the body doesn't know how to digest them and to eliminate them, then we're going to build up toxicity. So it's really a three-legged stool, and all three of those things are integral into health.
Very good. Well, thank you. Well, I'm going to leave here and go make an appointment with you. Thanks, Dr. Rowe.
Thank you.